The causes of drug use, of drug misuse are complex. The consequences are equally complex.
I started to check my life, realised that I wasn't going to live long if I kept up the way I was going.
At first, when I walked in the doors, I was 6.5 stone, fighting for my life, fighting to keep me hold, my child, my grandchild. Now I have that all, and I wouldn't know drug is worth it.
I can go on record and say tourists basically saved your life. You know what I mean? For me, that's speaking of my experience. You know, if I had no tourists, I don't know where I'd be. You know what I mean? In addiction somewhere, probably in a ditch.
And some people don't want to get involved, some people don't want to come off drugs. But there's always a time in everyone's life when they have to.
A decision myself and my friend made in Mount Troy. We decided and we worked our asses off when we got out to get into one of these places. We've tried Coolock everywhere, all the way down till we got took on here. This project was just, I would say, saved my life basically, because I was just going worse.
Often these sorts of projects are the last chance saloon for a lot of people. You know, people who work in this area will have been to many funerals in their working life, you know. And you know, the drug addiction deaths are higher than road deaths. So it's about believing and having a value for the people in our society. And you know, we're working with people who've come from huge areas of abuse.
Because if they're not there, if people have nowhere to go, they're just going to mix back into the old habits, their old way of life. They're going to, you know, end up, you know, at the end product is they're going to end up dead.
Without the likes of places like the Star and Yap and that, I don't think I would still be alive today. I was just hanging together on a thread.
There's nothing more important than you know, reaching out to people who are through you know, circumstances that any of us could have found ourselves in or could find ourselves in at any time in our lives. It's a modern issue, I think, more now than any other time, and it's a crisis situation. So it's very important to understand exactly what the value of it is and what the consequences of ignoring it is.
When I first started back in 1995, I mentioned one flat. I walked into a flat and there was a family of 5 all using drugs. And that was from brothers and sisters. So it would be absolute chaos. And we stepped in and there was crisis intervention. There's one stable on drugs in that family at the moment, and the other 4 are drug free.
Before these projects existed, drug use was very conspicuous. It was very much visible on the streets. People are comfortable now to know that there are local services that they can refer people to, that there is that support within the communities.
If we close down a project like this, it'd be a disaster. There'd be a lot of people back out on the streets, probably back on drugs, back thieving, up to no good.
If this project wasn't here, people probably wouldn't change their life. People wouldn't know where to go to change their life. People would probably be still running the streets, taking drugs and alcohol and causing mayhem.
Well, crime would go up, definitely. We all know that. We all talk about that all the time. Definitely would. But it would impact on the whole community. It would impact on people's families very severely, on people's children. You know, in terms of child protection issues, would go through the roof.
But it's done well and keep me away from drugs. I'm been locked up. I've been out over the year now, and usually I'm locked back up in 2 or 3 months.
It's very difficult to show in a quantitative way exactly what each euro that was spent on an individual will translate into. And we know from, I think, international evidence that anywhere between 1 to 4, for every euro that's spent on drug rehabilitation, the exchequer is being saved between 4 and 7 euro in, you know, mental health services, other health services, criminal system and so on. So there's an economic argument as well as a human argument.
I can definitely say we've kept about 20 people out of prison If they were to be in prison for 1 year, that 20, it's now talked about €80,000 to put somebody in prison for a year. So if we had 20 people that were going to be in prison, that's 1.6 million. Addiction Response Crumlin does not get 1.6 million, and that's for 20 people.
I mean, we have young people graduating every year in terms of drug free, or we have young people that's going through the services that could have ended up in prison, ended up in the hospitals. They're coming in here and they're accessing those kind of supports. They're learning how to live. They're learning to live in a community. So I mean, to justify, I mean, I really think in terms of value for money, there's no question about it. It's much more money to put them in a prison or in the hospital than to have them actually here in the community service.